Hello and welcome to our channel Let's Scratch It Out. Today we are starting with the second part of inflammation. If you didn't watch our previous video, I'll leave a link in the description below for you. So let's get started. Acute inflammation is mainly characterized by vascular and cellular changes. Talking about vascular changes, there are 4 stages in vascular changes, which are the first one is transient vasoconstriction, which is followed by vasodilation. So you must have heard before that in inflammation there is vasodilation. But what causes this transient vasoconstriction before vasodilation? So when there is an inflammatory process, there is an irritation of sympathetic nerve ending. But this effect is reversed by monoamine oxidase, which removes the neurotransmitter, which is noradrenaline, from the postsynaptic receptor. Then this transient vasoconstriction is followed by vasodilation. This has several mediators, but mainly the role is played by histamine. And the stage 3 is the main thing happening in this stage is increase in the capillary permeability. There can be 6 types, which are endothelial contraction, which occurs mainly in the venules, endothelial retraction, increased transcytosis, leakage from regenerating capillaries, direct endothelial injury, leukocyte-mediated endothelial injury. So the first step playing role in increasing of capillary permeability is the endothelial contraction. This occurs mainly in the venules. So why in the venules? Because the number of histamine receptors present over there are more than any other site. This process is generally short-lived and is followed by endothelial retraction, which involves a change in cytoskeletal structure. The mediators playing role in endothelial contraction are histamine, bradykinin, and leukotrienes, whereas in endothelial retraction they are tumor necrosis factor and interleukin 1. Next, it can be increased transcytosis. So what basically is transcytosis? Let this be the capillary lumen and let these be the endothelial cells. There are proteins present in the capillary lumen. Transcytosis is the transport of these proteins directly through the capillary endothelial cells into the interstitium. This process is mediated by VEGF, which is vascular endothelial growth factor. Next is the leakage from regenerating capillaries. Suppose these are the endothelial cells, but when there are regenerating endothelial cells, they are generally smaller than the fully mature ones. Here, the interendothelial space is more than what it usually is, which allows more fluid from the endothelium to pass to the interstitium. Next, it's direct endothelial injury, and then it's leukocyte-mediated endothelial injury. We'll be learning more about leukocyte-mediated endothelial injury in the cellular events in the next part of this video. So after the capillary permeability is increased, it causes pouring of protein-rich fluid into the extravascular tissue. This results in loss of fluid from the capillary, and thus RBCs are concentrated. This results in increased viscosity and finally slowing of blood flow. Now, as the blood flow slows, leukocytes and mainly neutrophils accumulate along the capillary endothelium, and then they are transcytosed to the interstitium. We'll be learning this process in detail in the next part of this video. During such situations of acute inflammation, lymph flow increases, which aids in draining of the edema. But many a times there is also inflammation of these lymph vessels. Now they are inflamed, it no longer aids in draining of edema. And there is a classical clinical representation of this phenomena, which is presented by red streaks near the skin wound. These streaks follow the course of lymphatic channels. Here we can see how they are clinically represented. Thank you for watching this video. Hope you like the video, and we'll soon be uploading third part, which will include cellular events. Make sure to watch it too.